Welcome back, and in this section we're going to learn all about the esophagus, or your food tube going through your chest. So it starts up at the lower part of your pharynx, is posterior to your airway, so it's just anterior to your spine. Sorry, I was having a little mental block right there. And then we'll travel through an opening in the diaphragm to get into the abdominal cavity. And here's what the epithelium in your esophagus looks like. So up here at the top, this is the surface right up here, and then right down here, this is where the basement membrane would be. Okay. Now, how the muscle is different in the esophagus is because the upper part of the esophagus has that voluntary swallowing part. What type of muscle does it have to be voluntary? That's right. So we have to have skeletal muscle fibers up here. So the upper third is skeletal muscle fibers. The bottom third is smooth muscle fibers. And in the middle is where we have the transition between the two different types of muscles. And so I mentioned that word peristalsis. So let me explain that to you. When the circular muscle contracts, then it mushes it down, and when the longitudinal muscle contracts, then it pushes it along. And so peristalsis is this rhythmic alternation between contraction and relaxation, which moves the food along the pathway. And this occurs in the esophagus, but it also occurs in the stomach, the small intestine, and the large intestine. So we're going to have peristalsis everywhere. It's just that this is the first place we talk about it, so this is where I explain it. This is to remind me, to have you guys remind me when we meet up to play a video showing you peristalsis so you can see how that looks. Really cool video, so don't forget to ask. At the inferior border of the esophagus, there is a sphincter, sometimes called the lower esophageal sphincter, but much more commonly known in what we are going to call it, the gastroesophageal sphincter. So notice that this is not called the esophagogastric sphincter, because the whole point of the sphincter is not to keep food from entering the stomach. Okay? So what a sphincter is, it means we have extra layers of circular smooth muscle in that area, so it can have a very tight closing of the opening. And the whole point of this sphincter is that when it's closed, gastric contents cannot go back up into the esophagus. So say, for instance, you're up studying late and you're eating chips, or you're watching a movie, you're on a date, whatever you're doing, and all of a sudden the TV show is over, or the fireworks you were watching are over, and you decide you want to go to sleep. Well, if you want to go to sleep, you'd like your stomach contents to stay in your stomach and not to wake up with them in your mouth and in your esophagus and possibly down your lungs. So this gastroesophageal sphincter is key for preventing the regurgitation of those gastric contents. And at the gastroesophageal sphincter, we are going to have a sudden epithelial change. This upper part is what the esophagus looks like. I have it like this because the esophagus goes in that direction, but if you're having trouble, just turn your head sideways or turn the picture sideways, because on the left side, where it's the darker purple, this is like where the basement membrane is. That's the end of the esophagus, and this is going to be the beginning of the stomach. So you can see that the epithelium on the stomach is totally different. And yes, you're going to have to figure out what that looks like too. So now I'd like to talk about something called GERD, which stands for gastroesophageal reflux disease. So if you've ever heard people talk about they have heartburn, or they have reflux, this is what they're talking about. And what happens is those gastric contents, which are very acidic, it has a pH of 2, which is more acidic than lemon juice, goes up into the esophagus, and essentially it burns the mucosa in the esophagus. And so I've got some pictures to show you. This is the normal epithelium. This whitish part is the normal epithelium in the esophagus because of the type of epithelium it is. It always has this whitish color. And then there's browner part, that's the normal epithelium in the stomach. As I showed you, it's a different type of epithelium. And this part right here, this reddish part, this is that burn way down here, just above the gastroesophageal sphincter. Here's a picture of a surgical specimen. Off to the right is the esophagus, and you can see its white epithelium. Over here on the left side is the stomach with its yellowish brown epithelium like there. And right here in the middle, this bright red part, this is the part where the acid from the stomach has just basically burned its way through the epithelium, the mucosa of the esophagus. And this greatly increases the risk of cancer, as does smoking and alcohol, if this happens long term. So if you know anybody who is popping their Pepsis or popping their Tums for 40 years, you just tell them they just need to go to a healthcare provider and get put on the right medications and get it treated once and for all. One more surgical specimen, and this time it's flipped the other direction. So over here on the left, this is the white of the esophageal mucosa. Over here on the right, this is the stomach mucosa. You can see this pinkish area, which was the area where we had reflux, and sitting right in the middle of it here is the cancer that has grown because of chronic reflux going on there. So yes, heartburn burns, but it has nothing to do with your heart. It has to do with gastric contents going back up into your esophagus. And so with this, we are done with this section on the esophagus, and I will see you again shortly as we continue along our pathway and where we're going to the stomach next.